All right. Hi, Marquita. How are you?
Pretty good. How are you?
Doing great. Thank you so much for joining me today for this interview. If it's okay with you, I was just going to give you a little bit of background about the hospital, about the unit you'd be interviewing to work on, and then allow yourself to, introduce yourself a little bit. I'll give you a little background on myself. How does that sound?
Sounds perfect.
Excellent. All right. So you are at North Shore University Hospital or interviewing for a position here. North Shore is a part of Northwell Health, and North Shore University Hospital is our flagship hospital for the health system. It's 756 beds with numerous specialties, including critical care, emergency. We have a women's hospital as well as a heart hospital located here. The surgical ICU, which is located here on campus, is 24 beds. It's also our trauma ICU. So we get a lot of level one traumas. We're the only level one trauma center on Long Island. We also see a lot of our ortho cases that come up here, ortho traumas related to that. Additionally, we have a transplant program here where we transplant kidney, lung, heart, and are working on a abdominal transplant program as well. So all of that kind of falls into the scope of the surgical ICU, which you're interviewing for a position for. So as background, I have been working here at Northwell Health and North Shore specifically for the last 4 years. I was a surgical ICU nurse for 2, and now I am the manager. So I'm very excited to continue to be a part of this team. I've really learned a lot with them, and I really enjoy growing it and bringing on great talent, really passionate nurses. So why don't you tell me a little bit about yourself?
Alrighty, so I'm Marquita Mantego. I am currently working as a triage nurse at Johns Hopkins Community Physicians. It's a family practice, internal medicine office, but I am looking to transition to go back into the hospital. I miss the bedside. I have a history in ICU. I have a history in labor and delivery and telemetry. Um, like I said, I miss the one-on-one interaction. Being a triage nurse is mostly just telephonic triaging. So I miss going, like I said, one-on-one interactions with our patients.
Excellent. Sounds like you have amazing background and experience.
Thanks.
Great. So I'm going to ask you a couple questions, and then if you have any questions for me at the end, feel free to ask away. So let's say I was your manager. If I asked you to do something unethical, what would you do?
So that is actually a great question. With you being my superior, I would definitely, unfortunately, have to decline. It's not actually unfortunate. It's just that I know it will weigh heavy on my conscience if I did do anything unethical. I know it's kind of easier said than done, but I do feel like we need to act ethically. And as nurses, that's definitely one of our major focuses, that we are to be ethical in to our patients in our interactions in our workplace. So I will have to decline or refuse to do whatever task it was.
That is an excellent answer. I hope you would say that. That's great. So could you describe a time for me where you were met with an unexpected challenge, and what were some of your initial steps?
Alrighty, so yes, back in May of 2020, I was new to my position now as the triage nurse. I was just like 2 months off of orientation. And, that's when the beginning of the pandemic, the COVID pandemic, had started. And I went into the office. We normally have 4 nurses on staff. Went into the office one morning to find that one of my nurses had tested positive for COVID, so she wasn't there. Another nurse had an emergency appendectomy, so she was in the hospital. The other nurse was running our Coumadin clinic, and so it was just me left to handle all of the triaging for the day. Initially, I was definitely nervous because I was new to the facility, and what I did was I enlisted the help of our medical office assistant, our phone room girl. So when patients called in, I told them to just set some expectations in like regards to there may be a delay in a return call from the triage nurse. If they felt like they needed to seek emergent or urgent care, to please go. Do not wait to hear from us. And then I kind of prioritized the patients who, based off of the acuity, who really needs to get called back first, and then took it one call at a time so I didn't get overwhelmed.
It sounds like you tackled that challenge in an excellent way.
Thank you.
Great. So, one final question for you. If you can improve upon one element of the nursing profession, what would it be and why?
I would say probably leadership and collaboration. In regards to leadership, it's I've had a lot of leaders and managers who are not as helpful to the staff. So leadership and collaboration in regards to burnout, I should say. So burnout is the major goal. So a lot of managers who aren't as helpful or supervisors who weren't as helpful, and that can cause like your staff to become more burnt out. Or in regards to collaborating, nurses with nurses, nurses with their techs, nurses with anyone in the healthcare field. I think in times when we are short staffed and where there is like a tremendous amount of patient care that needs to be done, if we pull together more, I feel like it would be less burnout because it would be like a shared workload. And I feel like a lot of nurses have left the field of the profession of nursing because of burnout. And it's not because of like they didn't like their patients, they didn't like their job. It was just that they were mentally and physically tired and strained.
Absolutely. I'm really glad that you brought that up. I know that's something a lot of our nurses have expressed as well. And being a leader on the unit, it's something that I want to make sure that we are all on the same page about and that we tackle this challenge together in the most conducive way possible. So that's something that's really inherent in our culture here at North Shore. And if you join us, we'd really like for you to bring some of those ideas to the table to make sure that you feel heard as well.
Perfect, perfect. I hope I can join.
Excellent. So any questions that I can answer for you at this time?
Actually, not at the moment. I don't have any at the moment. Thank you.
Wonderful. If anything pops up in the meantime, please feel free to reach out. The next steps will be our HR business partners getting in touch with you about some of the next steps in the interview process. But like I said, if there's any other questions that you have, please don't hesitate to reach out.
Will do. Thank you so much, Megan.
Excellent. It was a pleasure meeting you.
Same here.
All
Thanks.
right. Take care.
Bye.